Hello and welcome to the HealthTech Hour on UK Health Radio, the world's #1 talk health radio. My name is Steve Roost, and each week we bring you the best news, views and interviews with the CEOs, founders and leaders who are driving the health tech revolution in the UK and beyond. I'm a CEO and founder of a health tech company myself, and I'm passionate about the people and companies who are changing the world. Before we get to today's show, as always, we do a bit of business. I'd like to remind everyone to follow us on the socials. It's at HealthTech Hour. And also make sure you follow the station, which is at UK Health Radio. We've got tons of new presenters on doing some awesome shows. So make sure you follow the station to stay on top of everything that's coming up. Also, I want to thank everyone who's listening and who has listened and has got us to the 500,000 listener mark in less than 6 months, which is huge. So thank you very much again. Let's move on to today's show. It's going to be a good one. We've got Richard Wyatt-Haines, who's the director of HCI. Now, I'm guessing that the name HCI doesn't necessarily ring bells for many people listening. You know, it's not necessarily Nike, but this is one of the reasons why I love doing this show, because as I've said many, many, many times before, we do this show to highlight all of the fantastic companies that may not be, people may not be aware of them, but they're doing phenomenal things in the world of healthcare that make a difference to patients and individuals. And you may have even used their services without knowing about it. And HCI is one of those. So HCI have developed a platform called Connect Plus, which is fast becoming the leading app at use in the NHS to manage health conditions remotely. 25% of the UK population has one or more chronic health conditions. I guess that's close to about 20 million people. And we know that individuals now are having to adapt to a new way of being treated, a new healthcare system, if you like, to managing their conditions remotely at home and out of the clinic. That was already happening before the pandemic, but obviously, thank you to our friend COVID, that has accelerated the move out of the surgery, the move out of the clinic for treatment, and patients are having to adapt to that. Connect Plus is leading the charge in this area, and many, many people listening, as I said, you may have already used this without necessarily realizing it. So let's get straight into it. Richard, welcome to the show. How are you?
I'm very good, Steve. Good to see you, and good to see you this morning. It's wonderful to be with you. And congratulations on those numbers, by the way, to kick us off. Thank you. That's phenomenal.
Yeah, we're super happy with it. I mean, I think that we're lucky in the sense that the interest in this area has never been higher. It's getting higher and higher. But the fact that we keep bringing interesting guests onto the show and interesting companies that are doing amazing things, I think is making the difference. So I ask everyone coming on the show, it's been a crazy 18 months. What's the mood been like over at HCI, and what's kind of the mood in the camp like? How's it been over the last sort of, I don't know, the time vortex of the last 18 months?
Yeah, well, it's positive, I'm pleased to say. That always feels awful when you say it, doesn't it? In the context of what's gone on in so many people's lives. But digital health, supporting patients with whatever tools that you're working on, I'm working on, is just, there's the opportunity for us. And we've had to all step up to the mark and deliver some stuff, I think, pretty quickly, all of us, to make that happen. But it gives people focus, it gives people an energy, it gives them a buzz, and that's what we've got on and done. So it's been really good for us, really. Good.
And well, we're going to, sorry, go on.
I was going to say, the difference is, like lots of people, we've got people working remotely, and that for us still continues at the moment anyhow.
Well, look, I would hope that as a company that's leading the charge in remote monitoring, that you would be adaptable to remote working. One would hope.
Yes, no problems at all on that
one. So as regular listeners will know, we tend to do the show in 3 parts. The first part is more of an origins part around how you came to be doing all of the amazing stuff that you're doing. The middle part is all of the incredible stuff that you're doing at HCI with Connect Plus, or potentially with other things that you want to kind of showcase. And then the final piece is what's next. Obviously, this area, or as you said, digital health in general, but specifically remote monitoring, remote testing, anything in that area. That trend, I believe, is only going to accelerate further. And so it'd be interesting. I want to get your thoughts, make sure the listeners can get your insights into that as well. So quite a lot to pack into the show. So let's get started. So Richard, you've not always been in health tech. I think that's correct, isn't it?
That is correct. Yeah. So strange beginnings, retail banking, into then consultancy, strategy work mainly, wrote a book about the same thing. About how organizations can get themselves sorted out deliver on their strategy, and then got asked to write another book. Not sure why they came around for another go, but they did. And I thought, well, this is madness, because the people out there just don't have time to read a book. Their attention spans are shorter, and they were starting, even then, where are we, 7, 8 years ago now, to get more and more information using video. And I thought there must be a better way of doing it than by way of a book. So I created something that was about producing information-rich videos in 90-second bursts. Okay. And started playing around with that in legal and financial services. But then by happenstance, and these things often are like that, aren't they, bumped into someone in health and realized that in health, if you could provide patients with information around their condition, the treatment path they were on in short burst video, they go, that would be much easier than having to read some leaflet. If I can have it in the format I'm increasingly using everywhere else in my life, wouldn't that be wonderful? So that's what we started out on, and we tested it in pediatric day case surgery, where dads often came in with their children very nervous into a hospital where it's hot, they didn't drink, they didn't eat, and then the nurses found dads lying on the floor having fainted, and the children were on, waiting to recover from their surgery. And there was a thing about how to educate dads to not be so daft, and that's where we started. And it had an impact instantly. It was brilliant.
So look, let's break that down, because that was a lot of, I think you covered a relatively large span in the space of about 3 minutes. So let's just break that down. So when you first started in the world of work, retail banking or whatever it was, what was was there a plan, or what was the plan, like at that point?
No, early days, I don't think I did. I didn't do university. So where am I? Leaving school 79. But we sub 10% went to university in those days, so unusual. But I was doing retail banking. I didn't really have a plan, but I found myself increasingly impatient and then increasingly dysfunctional within an organization. And I thought, how am I going to change this? So I went out and got an MBA out of Warwick Business School. As part of that journey. I was progressing well, but it just didn't, it just didn't fulfill me. It didn't excite me. I just needed to do something different. And I'm ever so grateful for the background I got in banking, but I needed to do something different. So I went and got an MBA from Warwick. I did it distance learning, mixing it with work, children growing up, and all those pressures, all those
good things.
But I got an MBA, but the purpose was really to get out and do something different. And it was just brilliant. Really helped me a lot, enabled me to see things, and enabled me to just move out into consulting in that sense. Initially for someone, and then on my own account, and set up my own consultancy.
And so what was it about the MBA that was so sort of transformative for you from I don't know how, just from transformative, I guess.
It is transformative. It enables you to see outside of your narrow window what is possible. I remember the very first session I went to at Warwick. There were something like 250 of us in the room. We were from 70 countries around the world.
Wow.
Right. And there were people.
That's cool.
And you're just going, my head was just blown away by this whole concept. And there were people coming up, my peers, my fellow students, that were Greeks working in Sweden and then stood on a stage speaking in English to me. And I'm just going, hold on a minute. I don't know what's going on here. There's a much bigger opportunity than I ever dreamt of. And if I just take that small vignette, I think that tells you everything, I think. And then you mix with those people and they just challenge you, and they go, hold on a minute. What are you doing? Why aren't you doing this, or this? And you watch some great brains. I hadn't been exposed to at university. There was a guy in my study group from Oxford, first out of Oxford, managing TVs or something for Sony across Europe. And he could walk into any case study and he could analyze a brief almost instantly and come up with, well, okay, let's start thinking about it like this. And those people, that exposure, that thing about mixing with people that are far, far better than you is, I think, just illustrative of the way you should look at life, and finding people who work for you that are better than you as well.
Yeah.
Because they just challenge you. They just push the whole business.
Yeah.
And that's been a recurrent theme for me throughout life.
I think that's really interesting, because I think in my experience, there are people that almost seek out more, in the sense of they almost crave exposure to smarter people, more intelligent people, new ideas, and it becomes it becomes cyclical, right? You get so much from it that you continue to seek out those people, and that you want to be around people that think differently to you, that are smarter than you, and they bring different ideas to the table. But I think there's another group of people that basically shrink as soon as they interact with people that aren't necessarily they have like a fear response, a flight response almost to the whole thing.
Yeah, I think that's right. And that habit of just trying to find those people that challenge you, that unsettle you, I think is just invaluable, because there are moments in your life, you can see it, where something has triggered a thought, and that's led, when you look back, to something quite significant.
Well, it's like they call it the sliding doors moment, right? So I'm guessing by the sounds of it, doing your MBA was kind of a sliding doors moment.
Yeah, without doubt. And like I was a visiting fellow of leadership at the University of Exeter for a while, so just visiting alongside my other work. And there was a professor there, Jonathan Gosling, and he so often starts a sentence with, "I'm intrigued by." And it's just that mindset. It almost doesn't matter. It's what he's mulling over at the moment, what he's considering. I'm intrigued by, and then off he'll go.
Yeah. And
that mindset is just, he's looking to absorb other perspectives and other ideas. And I think it teaches you as well, not just to challenge yourself, but also to be more tolerant of a wider variety of views. And I think it's interesting. Actually, you've just reminded me, on my very, very first day at work, the guy I worked for, who, God bless him, must have long passed us, said to me, he said, during your career, he said, you'll work for managers who, he said, you'll see some things you like and some things you don't like. He said, remember the things you like and drop the things you don't like. Yeah. And he said, do that every day. And that was my very, very first day at work. As a youngster in Neasden, of all places, northwest London, and you just go, okay, and that's not bad,
it's not a bad lesson on your first day. So let's go scroll a bit forward. So you then got into so how did the video content idea came up? Because it sounds like your video content business or idea that was your segue into healthcare.
It was by the sounds very much
so. How did you come up with that, and why? And then at what point did that move from being an idea into, a thing, a business, a concept?
Yeah, that's good. So as I say, I'd written a book, and then Wiley's, the publishers, asked me to write another one.
Okay.
And ego, because writing a book and opening the box with your name on the spine is
it's got to be it's
an ego trip. That's what it is. Nobody buys or reads them, I'm sure. So it's pure ego trip. And I followed my ego and said, I'll go for that when they asked again. And then I was out running over the next couple of days, and I thought, this is madness. Why do it when, as I say, there were so many different ways. This is 2014. Okay. So many different ways in which people absorb information today, get their information.
Yeah.
And equally, if we look at, what's gone on in EastEnders, if you went back to the beginning of EastEnders, 30 years ago now, the average scene length is double at least what it is today. It is right? Just shrunk and shrunk. Yeah, because
that's a great statistic.
People will not sit there with that length of scene any longer. They want snap, 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 through it comes. So that's what you could see that happening. And I thought, well, if people are short of time and short of attention span, then there must be a better way than a book. And I was thinking then of, business people, because this would have been leadership and strategy again. And I thought, well, and what else is going on? And that the video thing, 2014 was big by then, but increasingly growing. And you're just going, that's where people are getting their information. That's where it will happen in the future.
Right.
So could you produce low cost content in volume? So it's sort of an operations management thing, I guess you could say, repeatedly, and do it in short bursts, say 90 seconds. So I just tried to find a model that would allow me to do that. And it sort of took off and started doing bits in financial services and legal services because they're very information rich.
Yeah.
And then by luck, I bumped into someone in health.
Okay.
From a trust near where I live in Torbay, the Torbay and South Devon NHS Trust. And they were just playing around with, well, how else could they support and help patients? And as soon as I heard that, I just went, hold on, there's something here to be done.
Right.
And
what were they trying to do at the time?
They were wrestling with, were leaflets good enough? What digital tools could be deployed to help people as they come through these journeys of care? And they were thinking about, well, maybe they could create their own videos, which is now commonplace in hospital trusts countrywide. So Torbay were miles ahead of anyone else, but they were still thinking about this as a traditional expensive model, whereas I was thinking about video as a manufacturing process. For me, it was, how do you produce large volume of video repeatedly over a long time? And that's where my head was, which then goes, you can change the price model, the cost model completely once you start thinking about that.
Right.
And that's what I set out to do. And it led to, we just started, it took about, it's interesting, isn't it? Tell us about health. I met that individual in February. We didn't do anything together until the November of that year.
Yeah.
And then it wasn't until late 2015 that we really started to produce some content. And we got quite quickly up to about 100 videos across things like I say, pediatric day case surgery, then hip and knee, shoulder rehab was a good one. So hip and knee replacement, people come into hospital when a couple of weeks before they're going to have their surgery, their knee replaced, and they have sort of education lesson, and it's delivered individually every time by 2, 3, 4 of the specialist nurses. But did they really need to do that? It's repeated stuff.
It's the same each time.
Yeah, it is. And actually, it's so much better. What we saw quickly was, it's so much better if a patient has a video that they can share with their family, because there are things you need to do at home to prepare for knee surgery.
And also people need to, you in a weird way, you want other people to be able to check that the person's doing them correctly. So let's continue this chat, because I know that my producer's in my ear telling me that we have to go for a commercial break. Let's continue this after a commercial break. We'll be right back. Hi, and welcome back. We are back with Richard from HCI, who are the producers of a digital platform called Connect Plus. So we were just picking up with Richard about how he got into, or how you got into generating video content for things like hip and knee replacements. So please carry on with that story, because I think it's really, really interesting as to how you then we can transition into what HCI and Connect Plus is all about today.
No problems. So yeah, we saw very quickly that you can do that remote support to patients using video. You can do it consistently, you can do it reliably, and actually what you facilitate is patients in the home understanding better what's going on, because they can look at it afterwards, think about it, reflect on it, and talk to their family members and get support. And it was really interesting. We did some work in cardiovascular, in heart failure, and people say, oh, a lot of our patients are old, they won't use it. But even if they didn't have access to the internet, which actually isn't really the case, but let's assume they didn't, what we found was that patients going home with, look, here's a link to these videos about how I can look after my heart problems.
Yeah.
They'd sit down with son or daughter with their iPad and jointly watch the videos and learn jointly over what they need to do by way of activity or diet or exercise or whatever. And that really helped the family engagement and support that could happen. So it works across the piece. And yeah, it was really interesting stuff. So we saw patients who were less anxious. We saw patients who were better informed. And we quickly saw patients saying, well, actually, I've got the information I need. I don't need another appointment. And we watched in shoulder rehab, patients having the videos for the exercise they need to do over a sort of a 12-stage process. And before they come back at each stage and come back and see the physio and get a sort of reworked bit of guidance. But now they just work their way through the videos step by step. And we watched 30% of appointments disappear.
That's fantastic.
It was just wonderful.
30% of the appointments gone as a result of video content. That's incredible. And so how at the beginning did you work out what areas to focus on? Was it led by your partnerships within the NHS, or was it sort of, okay?
Yeah, absolutely. The doctors, specialist nurses spotted what we were doing and would say, actually, we could use that in our area because we're doing repeating information. We've got lots of areas where patients keep asking the same questions because we're not helping them understand effectively. We could help them more. So that's what happened. And then we built in that journey, both with Torbay and South Devon NHS Trust, but equally trusts around the country, we ultimately built a library of around 850 patient-facing videos. There's another 500 for bit patient-facing things like, but also staff training. So we provide all the videos for Mountain Rescue England and Wales for their staff training.
Okay.
We do podiatrist training, but mainly it's for patients. That's what we do.
And in the early days, how did patients get access to these videos? Were they hosted on YouTube, or like how did they?
We always had a view that they needed a platform that could help. That we were supporting. What we enabled for the trusts. So we created our own platform that trusts can use and share with their patients, and they do it by a text or an email or a business card with a link on. And then they come in and it's like a walled garden. You know, a trust would have something like 600 to 800 videos, and they could just be shared by the trust, and people just move around and take a look. And what's happened in COVID, coming back to your earliest points, is NHS England have taken up that library, and we and have used it as a response nationally through the COVID period. So there's and it's for all your listeners to go to, but sponsored by NHS England, and it's www.healthandcarevideos.uk, and there's about 600 videos on there to help people understand their condition, manage what's going on around them, around treatment areas mainly. It's not public health, it's treatment areas. So I'm coming in for an MRI, I've got vertigo, I've got diabetes. What do I do? I've got rheumatoid arthritis, and actually I'm having a flare. What things should I think about? So that's there for people to use. It's free of charge, and it's available.
And that's healthandcarevideos.co.uk.
No, healthandcarevideos.uk.
Healthandcarevideos.uk.
And it's there for everyone to use.
That's a great resource. And I guess your sort of competitor, for want of a better word, is Mr. Google, Dr. Google, right?
Yeah. I think it's just a safer environment. Everything we got on there has been created with and signed off by NHS clinicians. Absolutely everything. There is nothing. And there are links to charities and links to other resources. And that's being used by hospitals and GP surgeries countrywide now. So please take advantage of it. It's honestly, it's there for you, all of you to use.
And how, because I know that you sort of grew in a way, you saw a great opportunity, a real need, and you sort of grown organically almost from there. How, just taking this concept of, videos replacing what was previously there in terms of patient information, treatment guidance, that kind of thing. Can you quantify how big of a problem it was under the old model? I guess let's call it leaflets or printed material. And, like what scale of things are we sort of talking about in terms of a, shift or improvement in care, or, reduction in appointments, or like, how do you guys think about that for that video piece on its own?
Yeah, I think that's That's really, it's a good way of looking at it. You can look at it from a patient point of view. You can look at it from staff members' point of view in terms of the number of appointments, and you can look at it as a health system in terms of cost. So if we take patients, we continually survey patients to get feedback on the videos. What do they do? How do they work? The scores are superb. The one that always is important to us is that regularly between 60 and 70% of patients will say in surveys that they haven't had need for another appointment or an extra appointment with their healthcare professional because they're using the video. In other words,
that's a great stat.
And it's
that's
60
awesome.
At the moment it's running around 62. It's been as high as 67.
Yeah, but like stopping
removing
appointments from the system is a huge, that's a direct cost saving.
Yeah.
Right there. So that's fantastic.
And then for trusts, if you took it at the other end and picking up on your point there, we always target an 8 times payback, but we generally get around 13 to 14 times payback for a trust.
Okay.
So that's broadly what we're looking at.
So for listeners who, what does that really mean in like?
So if a trust puts in, it says, well, I'm going to buy a service from you and it costs them £1,000, it will save them. We target £13,000 is what we will generally deliver as a saving.
Well, and let's not forget there'll be presumably far fewer bundles of printed leaflets stacked up in the corner of
not even counting that. And you haven't got. The other thing is, and we forget this for patients, don't we? They're not driving in and out of a hospital car park so much with
there's all these indirect costs, issues. Right? There's they're not having to schedule an appointment, take time off work, organize a childcare to take the kids, pay the parking, like all that type of stuff. No, I'm completely with you. All of the secondary costs and tertiary costs.
Yeah. It's so hard to measure those, but they're so important. Just for people's well-being, I think. Generally,
financial and emotional. And so how? Let's talk about Connect Plus now.
Okay.
I think that's really exciting what you're doing there. So why don't you explain to the listeners what it is, and then how you transitioned, or what the kind of journey was from the video proposition that you had that was very successful, very scaled up, into that sort of Connect Plus piece.
I will, no problems at all. So for listeners sitting there this afternoon, they'll know somebody, or it might be themselves, who's got a health condition. Could be diabetes, it could be heart failure, as I've touched on, it could be kidney disease, it doesn't matter. And if you know somebody with one of those conditions, there's a reasonable chance that you or the person you know may have a second condition. So a quarter of us have 2 or more conditions. Okay. So if I've got diabetes, there's a 1 in 4 chance that I've also got heart failure or COPD or rheumatoid arthritis. That's a lot of people. And that's not just the UK, that's globally. And what happens is, as a patient, if you get seen by your hospital system, you might be given an app to help you manage your condition with information on it. But if you've got diabetes and you've got heart failure, let's say, you might be given an app for both of those. You might not be given an app for either, and you might just be left with bits of paper. But you might be given one for both. But actually, why, as a patient, should you have 2 apps? I don't get it. I think I'm a patient who happens to have diabetes and heart failure. I'm not a diabetic, and I'm not a heart. I'm still Richard with a couple of conditions. And we saw this going on, and we said, well, this is mad. Why not bolt together everything for all the conditions people could have in one place? Not only does that mean patients only have one place to go, but equally, as a hospital system, I can look at you, Steve, and say, this is Steve here in front of me, and I can now see the details about him with his heart failure, with his diabetes in one place. So it struck us that could we build an app that would use the stuff we'd learnt in video, the videos themselves, and all that useful information that would help patients in one place. That's what we started by doing. And we originally worked with a rheumatology consultant called Kirsten Mackay, and looking at rheumatoid arthritis and all the rheumatology conditions. and she was an absolute star. And we just started building from there. We built rheumatology, then we started building other conditions. But we built a tool, Connect Plus, that could take as many conditions as need be. So if you're a hospital and you want to pick off your main conditions, ones I've listed, kidney, heart, diabetes and the like, fine, you could do that. But if you were a specialist hospital and you were dealing with a rare disease, you could put that in there alongside those conditions as well. And that's what we did. And when we were doing lots of research with patients, we watched them coming along, all ages, with like I say, multiple conditions, but also with bits of paper in there that in their bags, that where they recorded their symptoms and how their disease was progressing and what was happening to them on a day-by-day basis. But it was all bits of paper, and what medications were they taking and when was their next appointment. So we said, well, hold on a minute. If we could put multiple conditions with information about how to manage, how to care, what to do if A, B, or C happens in one place, that's good. But if we could also give them a place that they could record their symptoms and their disease progression, where they could make notes about how am I doing, where they could take a note of their medications, both what's being prescribed by their hospital doctor, but also by their GP, and also, what they've gone and bought over the counter at their pharmacy. I take vitamin D in the winter. Well, let's make a note of that, because actually, when I start taking it, does it have an impact on the pain in my elbow and all the rest? So that's what we did. So we built Connect Plus so that it could firstly do information across multiple diseases. Secondly, capture information so patients had everything in one place that they could see and their doctors could see. And then we built it so it could be tailored to every hospital that wanted to run this. So it wasn't a national program, because doctors like their own pathways of care, their own treatment programs. So we had to build it so it was flexible enough that it could just be adapted to every site that wanted to use it. And that's what we set out to do.
So when what was the key insight that you found, that where when you said, okay, there's people with different conditions, 2 conditions, and all those things? I totally understand and I completely agree with you. What was the key insight, and how did you get it that Connect Plus was what would solve that potentially? Like, how did that happen, and what kind of when was that moment?
Okay, that's a combination of engaging with people in focus groups, in just discussing with people. I always worry from a marketing point of view that they tell us we should research first and then build a product. I think as what you do, what I do, Steve, is we see a need and we build something to satisfy that need. And if we sat around waiting for focus groups to tell us, it's usually gone and it's passed us by, or focus groups will tell us something else, because they can't visualize quite what you and I are holding in our heads as a concept. But once you've built the outline, you can then ask people to go, right, now then, what can we do with this? How do we improve it? So we had patients, we were just in front of them watching what they were doing, how they were behaving with this thing. Initially, when it was a single app, and then there was a business piece, which is Hannah, our lead developer, just started learning from the feedback and playing around with the code. And she said, I can do this for you. I can make this multiple conditions across multiple sites. And thanks to Hugh Kelly, one of my fellow directors, those 2 of them had the insight to go, no, there's something we can really do here to meet this customer need. And they just rewrote the original plan we had and just went, no, hold on, multiple conditions, multiple sites, we can do this. And they just made it happen. And I still remember the day Hugh called me over and he said, I want to show you something. And they hadn't said anything to me. And they showed me, it was more than a mock-up. There was code written. And I looked at it and I went, that is game changing. And you remember those
moments.
You remember those moments. But it's a combination of aspiration. We want to transform healthcare. Patient feedback, skills of people in the business that go, no, there's a different way of looking at this. There's a different way of solving this conundrum. And you bring that lot together. And in our job, is it not our role to provide a platform on which people inside and outside the organization can have that thinking, have that moment, have that opportunity to perform at their very best, to deliver something unusual? And maybe that's our job, is just to provide those platforms, those at stage on which people can go out and really perform and do something special.
I would agree with that. I mean, one of the reasons why I love early stage businesses is that, pretty much every day is a new day. I mean, there's nothing's prescribed. You can, you have the opportunity to do something truly world changing or game changing every single day. Because almost by definition, no one's really ever done it before. There might be, even if people are in your space, everyone does things differently, so it's an opportunity to do things from a blank slate, as opposed to sort of, there are people that fit larger corporate organizations. It takes all kinds to make the world go round, but in those organizations, the challenges are a lot more difficult. There's a lot more politics, there's a lot more process, there's a lot more, those type of things. It's sort of about efficiency. How do you do the same thing more efficiently? Not necessarily how do we do something completely new? And anything strategic takes far, far longer. So no, I completely understand. So we're going to go to another commercial break now with the supporters of the station. And after that, I want to pick up on why did you start with rheumatology? And then I'd like to go into you taking us through what you see as a patient from Connect Plus. Like, let's go through the actual journey. So we'll be back in 1 minute. Hi, welcome back. We're talking to Richard from HCI, who have developed a platform called Connect Plus. So Richard, before the break, you were about to take us through, first of all, let's actually start, let's flip it around and let's go through from a user's perspective or a patient's perspective. How do they find out about Connect Plus? How do they get it? And then what's the kind of pathway that they go through? How does that work?
No problems at all. No problems. Well, the most common way people get it is it's prescribed, if that's the right word, by their hospital consultant generally, because we generally work out of hospitals. But it's downloadable from the App Store. You can see it there. And there's a website, www.connectplus.digital. Okay. So, so they're prescribed it by their clinician, generally because that doctor is working with us to support them with their patients using Connect Plus. And when they open it up, what they'll be broadly, they'll see their condition, and within their condition, and at the moment, we're still relatively new. We'll have about 40 conditions live by the back end of this quarter. Okay. And back end of next year, we could be 100, 150 plus conditions in this thing. But they'll see their condition, and there are some key bits that they'll be able to see on the app. Firstly, there's information about what their disease is. And I say disease, we're increasingly seeing not just, we started in long-term conditions, but actually we're now doing programs of work in hip and knee replacement, colonoscopy, so helping people who are having a treatment pathway as well. But let's say you'll see your condition, they'll tell you what it's about, what you should expect by way of the disease, your early months of after diagnosis, what will happen, what are the things you need to look out for, but just guidance. And it's a mix of text and video on the app. But that's the core bit. But there's also things like frequently asked questions sections. But there's a really important bit patients like, and that's the clinic locations for your hospital, for the service you're getting support from. It will show all your hospital locations and where you could go for an appointment, what you should expect when you get there, parking, things like that, but also details about the team that's looking after you. And that's not just the consultant, it will be details about the consultants, the specialist nurses, the admin team, the physio team, the whatever is making up the whole team, and who they are, pictures of them. So it's personalized to your...
Yeah, I was going to say, do you know what that reminds me of? That's something that I talk about all the time, which is, bringing healthcare and access to healthcare service in line with the way that everyone lives their lives. in this
Yeah.
right now, the bringing all of those services, or as many as possible, in line with the way that we live our digital lives now, which we all do through our phone or through tablets or through, we have in every other aspect of our lives, we have a very high level of digital integration, except in healthcare, and it's getting there, don't get me wrong. But, like, for example, if you were to go and see your dentist, you would go to their website, you would have their picture, you would see all the information about them, and the dentist might have an app, and however. So I think what you're doing is really interesting, which is making it a lot more, usable, user friendly to access those services. I think that makes a lot of sense. It's probably like a bit of a sleeping giant. No one's really thought about that really low hanging, obvious type of fruit that is so obvious in other areas of the world of life. I think it's great.
Yeah, and personalization is important. One, it makes the clinical team more engaged, but actually for a patient sat on the other side, I know who these people are, and and that's therefore
it humanizes it, right? It's not like you're not just going to like room 14B on the third floor. It's sort of like there's a team and I'm being taken care of, and I understand who might be there and who might greet me, and I understand the process, and I think it makes it makes total sense.
It's interesting because on there you're just making me think about highlighting points actually. But there's a button, if you want the rheumatology physio team, you press the button and it says call this number, and you're not going round the houses. You actually end up at the team, as it should happen in every part of your life. It's right. It's easier.
Yeah, that makes total. So you can skip the hospital switchboard.
Yeah, you just go direct, and you just go, thank you.
This is why I love doing this show, is because sometimes people come on with they've identified a problem that people did, that everyone knew was a problem, but no one had necessarily come up with an easy way to solve it, which you basically have done. We had another company on called Infinity Health, a guy called Elliot Engers, who's the founder there, and their digital task management in the NHS. And that they realized that they basically managed to save 10,000 hours of porter time in one ward alone in a year, just by moving people from paper to a simple online digital tablet-based version of task management. Like, great. No more people get lost on the way to X-ray.
Yeah.
Cool.
and people at home will be listening, well, do people get lost on the way to X-ray? Oh, yes.
Yeah. Well, no, but then that's the thing, is that it was sort of, that's why we do the shows, like to try and make people understand why this matters to you as a patient, right? It matters to you as a patient because if you miss your X-ray appointment, you might get delayed for 24 hours. If you don't get taken back to your bed, then you might miss the doctor round, et cetera, which could delay treatment. Like all these things which you don't realize are kind of going on in the background of the system. All these system related things actually have an impact on your health.
Yeah. And it's in the same way, like I keep on that rheumatology example, but there's people with rheumatoid arthritis have problems with their backs, and they ring in and they say, I need to see the rheumatology physiotherapist. But now the HealthTech team will go, well, hold on a minute. And that could be an administrator, not a nurse. So that's better. We'll say, hold on, have you looked at the video on the app on what to do? Oh, no, I'll go and do that. And they go off and do that, and they can get instant relief. Right. And what that does is free up space for the physio or a specialist nurse or a consultant to see someone who is in more desperate need at that point in time. Yeah. And that's so important, because at the moment, at some point, the person with the bad back will need one of those slots because they will have had a flare.
And it's only through services like this and that you're going to be able to triage people in real time for these issues. Absolutely. You have to, if you want to do triage in real time outside of a hospital, you have to go for a digital solution now. Yeah. There isn't another way to do it. And you definitely can't go to the GPs and things like that, because it's just not, at the moment, they're overwhelmed. And so if services, which I believe that they do, they need to get more efficient at making everyone work up to the top of their license, in effect. So maximize the efficiency of healthcare staff. You need a way to manage and triage and deal with things that that can be dealt with in a way that don't involve those healthcare staff. But actually, as I think you found, patients kind of prefer it. They don't want to have to go to hospital if they don't want to, if they don't have to, but their back hurts and they don't really know what else to do.
Yeah. So if you can make that available to them readily and easily, even without ringing in, because they can just scout around the app, so much the better.
Yeah.
So just other bits on the app.
Sure.
So lots of information about disease, frequently asked questions, who's my team, who's looking after me, where do I have to go for my meetings, and then the interactive bits on top of that are a section to record your appointments with a reminder, but also we're using it now for not only does it remind you to do your appointments, it reminds you maybe to do your exercises, and then a video pops up to show you what the exercise is. Your meds, your medications, you can record that. And then a really big bit, you can record your symptoms. So what's your pain like? How is your sleep pattern? How is in hip and knee replacement, how flexible is your knee both before and after surgery? Linking to a Fitbit, how many steps are you taking a day, which illustrates to your surgeon how you're recovering after your surgery. So lots of symptom trackers like that. And in your own area of work, you can then start, once you start thinking like that, all sorts of things can be tied in to gather information that is data alongside the information giving bit that is what we do. And that then enables, I think the feedback loop is so important for a lot of this. We did, symptom tracking for clinicians, but actually if I'm a patient and I can see that my graph, my condition is improving over time, I can reflect for myself what it is that I've done, that I've changed, that's helped me get a bit better. And that, I think that's about empowering patients. Information and feedback is,
again, with a lot, I mean, not with all conditions, totally granted, but with some conditions, your prognosis, if you like, is dramatically impacted by your own activity or lack thereof. And so anything that improves empowerment is likely to improve a prognosis for that set of conditions. So, and I'm a big believer is like, you can't, if you look at the science of behavior change, and it's all based on goal setting, right? But there has to be a feedback loop. There has to, otherwise, if there's no ability for anyone to get real-time data about their progression, the entire thing falls down. So you need to be able to have that documentation to understand, how that's why we've done PocDoc, because there's all these vague statements about, switch to Flora and reduce your cholesterol. So, well, I don't even know what my cholesterol is right now. So how do I know that exercising anymore is going to make me better? But if you can provide that feedback loop, then there's a huge amount of science that says that your progression and your activity and your positivity will increase, right? So you're even more likely to hit your goal.
Yeah, very much so. And a piece of work for us in the future is looking at that behavioral change component, because I think we haven't even scratched the surface. You asked about, what are the outputs? I don't think we've scratched the surface on understanding what actually is possible and we're going to do that. We're going to do that with a local university, University of Exeter, to just dig into that, because we're going to have to get at it, because there's so much in there.
Yeah, I think so. Completely. I completely agree. I think if you run that research on a platform that combines really clinically solid video content about how to manage your condition, information in one place about how to interact with NHS services, tracking medication, all that type of stuff. I think that there's going to be a huge kind of, I would imagine that there'll be a big positive outcome from people using that. So just before we go, there's a couple of areas that I want to cover. I want to make sure that we cover them. So the first is, what has the reaction been, or what kind of success metrics are you seeing from patients and from clinicians about Connect Plus?
Connect Plus is a much more precise way of using video and information than we could ever do with the old video libraries. And I think I'll pick up a couple of patient responses. One, Lily, who's in early 80s, I think. She'll tell me off for saying that, but I'm sure she is. If you look at the app, she says, you can get all the information you need. You don't need anything else. It's good for me. But I think Valerie who's an MS patient I believe this app is a powerful a tool for empowerment. I actually see I can do this. I can cope.
Right.
Now, those two quotes for me are massive, because that's about people going, and we get good scores, but actually it's about her saying, I'm empowered. I can cope. And Lily, I've got the information I need. And dear old Lily says, I recommend it to lots of my friends. Well, she's in her 80s, and she just goes, well, this is the way to operate. I don't want bits of paper all over the place. So that's good. And then in terms of performance, the early stuff coming through is still on rheumatology but that doesn't matter. So during COVID, where new patients with rheumatoid diseases need to put on some very strong medications, we saw we were able to educate remotely 62% of patients who would have, if 100 would have been coming through to the hospital, 62 of them we could do remote education.
Wow.
And that was it. We've got a 50% reduction in appointments around the use of injected drugs in rheumatology.
Wow.
And in some of them, we've reduced up to 75% in some of the drugs in terms of number of appointments.
And that's down to people doing their exercises because they can see their exercises.
They've been educated about how to take on these new drugs, and they don't need to come into the hospital. And MS, we've seen a reduction from a 90-day waiting list down to a 20-day waiting list over 6 months.
Wow.
So we're talking big numbers.
I mean, that's a massive shift.
Yeah.
Those are
honestly, because you're helping people where they want to be helped at home.
Right.
That's where they want their care to take place. And hospitals don't want people filling up their corridors. They don't need to any longer.
Well, yeah. I mean, look, this is all going to accelerate, right? I mean, this is the new normal. I mean, this is healthcare now,
Yes, it is. And it's wonderful. I think wonderful.
Well, I mean, that's the thing.
For everybody.
The numbers and the feedback speaks for itself. What you're not trying to do is enforce a model of care on people that don't want it, right?
No, it's digital first. But if digital isn't possible for people, what you've done is create the space to make sure we can care for the people who maybe can't access digital. And we've created space for those people who need urgent, intensive care to be cared for, because we're going to struggle. We've got numbers backing up. We've got to find ways of solving that conundrum.
Yeah, no, I completely agree. So quickly, we've got like 2 minutes. So what's the future, the next 12 months look like for Connect Plus or HCI or both?
No troubles at all. Growing the number of conditions in there so we can help more and more patients. Growing the number of hospitals we support. So again, we can help more and more patients and more hospitals. Looking overseas as well, because it translates. We can write this in different languages. We can write it to local needs. And also beyond that, I think it will take us more than 12 months, actually looking at that data where you've got data across multiple conditions in one place. What is that telling us about people's symptoms when there's a correlation of 2 types of data and they've got different medications in those different conditions? What does that teach us? So all that is those are things we're looking at and developing.
I think that there's, if you can become the platform of choice to interact with patients about their treatment pathways, about their meds, about all of those type of things, I think that there's a huge opportunity. I mean, I think there's some of those statistics that you just quoted are kind of really crazy. I'm actually slightly shocked that they're so good. I mean, reduction, from 60% to 20% of appointments and things like that.
The knee surgeon we're working with is targeting an 80% reduction in post-operative appointments using it.
Wow.
That's his target, not ours. He created it. We don't know if we'll get there yet, but that's what he's saying I think is possible. I do not need to see these people post-operatively if I'm getting this data.
Wow, that's fantastic. Well, look, on that note, I would like to say, Richard, thank you very much. Richard from HCI and Connect Plus. You can download Connect Plus from the App Store. Or what was the website again, Richard?
www.connectplus.digital.
Great. And you can manage all of your conditions and do all of the rest of the stuff with the app. But yeah, would recommend that anyone go and check it out. So Richard, thanks a lot for coming on the show. And thank you to everyone for listening. And we'll be back again next week with another great guest. But thank you very much, everyone.
Thanks, Steve.